Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Rajalakshmi R. She is the past president of IMA in Udupi, and now she is the present president of Gynecological and Obstetric Society. And apart from that, she is a very popular gynecologist and obstetrician in Udupi, and she is the one who is bringing awareness among the younger generation. And in continuation to her effort, today she is going to talk about the optimal health during the pregnancy. Welcome, Dr. Rajalakshmi.
Thank you, ma'am. Thank you for the opportunity.
What is this optimal pregnancy?
Yes. To get pregnant, we need some health indices in their place. So before getting pregnant, the mother should be healthy. The father also should be healthy because both of their chromosomes will go into the baby to make a baby.
Correct.
So
Yes.
they have to be in optimum health. They have to be of the optimum age, first of all. Age window of 25 to 30 for a lady and 30 to 35 within 35 for a male is most important because too low age, smaller age for the ladies will have problem during pregnancy and delivery. If the age advances, there are more chromosomal aberrations and we can have Down syndrome, Edward syndrome in the baby. So the fertility will be good if they conceive between the age group.
Yeah.
So that is
and
one.
This is very important because nowadays the younger generation, they're concentrating more on their education, more on their profession, and as a result, they're postponing their marriage and becoming pregnant. And that is a very dangerous one. So that can lead to infertility also. Now, apart from the age, what about the weight?
Yes, everything has to be optimum. So optimum weight, I can't say this many kgs, but for their height, we say in BMI. If the BMI between 19 and 24.5, that will be good. If they are on the overweight, they have to reduce the weight. If they are below the age weight, they have to gain some weight, put on weight, and then get pregnancy.
Okay.
So that is
now, apart from the age and the weight, what are the health indices that you look for and that is very important?
Yes. First one is their blood indices, the hemoglobin. Hemoglobin should be between 12 to 14 gram. Otherwise, they can have growth restricted fetuses, bleeding during pregnancy, complications can occur. Then they have to have a optimum sugar levels. The random blood sugar and urine sugar we usually test. If the sugar levels are high, because some ladies are already diabetic when they conceive, so that can cause neural tube defects, congenital heart defects, and the baby can grow big, macrosomia we say. There can be problems with the delivery, and even the baby can have some injuries
the heart
during
diseases
delivery.
also, and the injuries, and then neuroplaxy, and then
Plaxi,
they have to go for the cesarean section. Yes.
Yeah. Okay. Then third thing is we usually check for their thyroid. Thyroid has to be optimum. If it is hypothyroid, there can be difficulty in conceiving. There can be multiple abortions, and the baby might have little low intelligence. So we have
in fact,
to
they can as soon as the child is born, the thyroid has to be tested because initially we may not make out, and if it is too late, then it is difficult, and hence we have to advise the mother to take the iodized salt. So unless they take the iodized salt, they can have the hypothyroidism also. That is one of the causes.
It can cause. And then we do check vitamin D also. We rule out any sexually transmitted diseases in the couple. We also rule out any genetic diseases. We screen them for hemophilia, thalassemia, and we do genetic counseling also. So these are all the health indices we look for.
No, we say marriages are made in heaven, but they have to live here. And if they don't want their life to be hell, they have to not just the jataka, the medical jataka also has to be prepared.
Yeah, horoscope matching.
Horoscope.
Yeah, that has to be done. Yes, ma'am. And we do give them some advice. First advice is on their food. They should have a wholesome, nutritious food, which has the carbohydrates, proteins, and healthy fats. including fibers, so that the digestive system is functioning properly. And they have to avoid all the fast food, excessive salt, excessive sugar, oily products, and whichever has preservatives.
Smoking,
Yes,
drinking, and also
drinking and
junk food
drugs.
and the foods containing artificial preservative
Ash-
as well as the
And
coloring agent. Yeah.
coloring and flavoring agents to be
Yes.
avoided. And we ask them to, like you said, avoid all the bad habits, whichever form they are.
Correct.
Because
Correct.
smoking, we say here, if you go to rural survey, they use that nashia. They roll the
Yeah.
BD and they smoke that. They take the
And
smell
they
of that.
get to chew also.
True
Yeah.
also. So any
Yes.
form of nicotine, alcohol, or habit-forming drugs to be avoided. It should
Yes.
not be taken.
Yes.
And they have to be stress-free. That is
Yes.
also major point. Their
Yes.
mind has to be free, because if they are under stress, they can go into many complications. So they have to maintain a sound mind in a sound body to get pregnant. That is
Yeah,
what we
and
tell
for
them.
that, if they do the yoga, in fact, the yoga is very beneficial for having a normal delivery. So the pregnant lady should practice yoga to have mental and the physical health. And
Yeah.
apart from that, sattvic ahara,
Ahara.
more of the fruits and the vegetables, and
Vegetables.
and
Yes.
anything containing more fibers and the micronutrients, and that is also very, very important for the
Calcium,
growth. Yeah.
magnesium, zinc, all
Yes.
those things should go. So they should
Yeah.
have a colorful diet actually. And
Yeah.
supplements should be included like irons and calcium. And we usually also give folic acid.
That is
That
very
prevents the
important.
neural tube
Even before becoming pregnant, they should start
pregnancy.
the,
Folic acid. It will prevent
yeah,
the neural tube defect. So we started pre-conception also we give.
yeah.
One more thing
When you said
important is,
preconception, yeah, yeah, please go ahead.
yeah, one more thing important is exercise. There is a feeling that once a lady gets pregnant, she should rest. No, prenatal also, preconception, even during antenatal and postnatal, she should be active. The grading of exercise may be mild, moderate, severe. Severe, we tell them to avoid, but they have to be active. And this exercise helps them to keep a weight, maintain their weight, as well as keep a stress-free mind. So that
Okay.
has to be there.
Yeah. I just
Yes,
wanted
ma'am.
to ask you because you are saying that preconceptional folic acid. Now, how should they know that the window period of pregnancy? You explain to the
Good
younger
question. Good
generation so
question.
that, they can
Yeah,
have the folic acid and then
good.
go and
And then
become
get.
the pregnant. Yes.
Yes, ma'am. Good question, ma'am. Usually, the people usually plan pre-planned pregnancy. It is not accidental pregnancy these days. So when they come for pre-pregnancy counseling, they do come now asking for what they should do. All these advices we give them. We educate them on the fertility period, fertility window. So if a lady has 28 to 30 days of a cycle, menstrual cycle, the middle period, the egg will not be there on every day. It will be there only in the ovulation time. Ovulation happens on the 14th or 15th day of the cycle. So 2 days prior to that and 2 days post ovulation will be the fertile period for that lady. So we do educate them if on their fertility window, when if they
Okay.
have a physical contact, they can get the pregnancy. So
So
that
that means
also
they have to
some
count from the day of periods. The day
period
of periods,
starts.
they
Yeah,
have
the
to count.
day it starts.
Yeah.
Yeah, this is
And
in
if
a
the
normal
husband is
cycle.
out of station, they cannot. So they must
Yeah,
remember
yeah.
that also. Yeah.
Yes, yes. So they have to count, and in it's a normal cycle, 28 to 30-day cycle. If they have a prolonged cycle, this might vary. And they can make it out in, like, if they observe carefully, the cervical mucus, what secretion is there in the vagina, the consistency alters, and there may be little extra in around that ovulation that can be made out. And even
Okay.
their body temperature mildly increases by 0.5 to 1 degree. So that
Okay.
also indicates that they are ovulating. So these are the natural methods to know, because
And
if they have a,
psychological also, the moods will be slightly fluctuating during that time. So,
yeah, and because these are the, see, when the cycle is prolonged or something, if it is not 28 days, how to guess when it is ovulating? So these two are the methods to say. And some people do have a mild pain on the side of the abdomen from where the egg is getting released. We called it as mitral smudge or ovulatory pain. So that also
okay.
indicates that. So you
Oh,
have to time the intercourse between
okay.
during that
Okay.
ovulation.
Okay. Okay.
Yes.
So thank you very much, Dr. Raj Lakshmi, So nicely and so lucidly you have explained how a woman should prepare herself for pregnancy and then follow the pregnancy till the
Yes.
delivery. So thank you
Yes.
very much.
One point, ma'am. Some of our ladies are already on some medications, maybe asthmatics,
Yes,
maybe
very important. Yes.
hypertensives, yeah, maybe epileptics, or maybe psychiatric
Asthma.
drugs, because
Yeah,
nowadays
drugs
there are
for the
many
depression.
complications.
Yeah.
Depression. So they need to consult their concerned that particular specialist doctors to tell them that we are planning pregnancy. Do we need to alter this dosage? Do we need to change the tablets? All that has to be discussed prior to getting pregnant.
Yeah, yeah. So very,
Yeah.
very, very most important, because any drugs in any form is not good. So the natural
Hmm.
food is very important. Taking the milk and milk products and fruits and
Yes.
this thing and be happy with everything and
Yes.
maintain
That is
your
the
blood
most
sugar and
important
this.
thing.
Yeah, that is the most important. Keep smiling and enjoy your pregnancy rather than feeling bad about it. Thank you very much, Dr. Raj.
Thank you, ma'am.
Namaskar.
Thank you so much.